A study at New York's Weill Cornell Medical College shows that a brain energy crisis may spark Parkinson's disease. Brain cells make up 2% of body weight, but consume 20% of the body's energy. The brain energy crisis is caused by malfunctioning mitochondria. Mitochondria are sometimes described as cellular power plants because they generate most of the cell's supply of adenosine triphosphate, which is used as a source of energy. The dietary supplement Coenzyme Q10 helps the body produce adenosine triphosphate, and without sufficient quantities of CoQ10 in the body, your cells cannot produce ATP efficiently. In an article entitled Oxidative Stress to Dopaminergic Neurons as Models of Parkinson's Disease, Coenzyme Q10 protected striatal slice cultures against the neurotoxin rotenone. Specifically, CoQ10 supported the activities of tyrosine hydroxylase and ATP synthesis. The results of a 2002 University of California study showed 1,200 milligrams daily of CoQ10 slowed the progression of Parkinson's disease by 44%. This trial suggested that coenzyme Q10 can slow the rate of deterioration in Parkinson's disease. However, before the compound is used widely, the results need to be confirmed in a larger group of patients. The 2011 study did not duplicate the results from 2002. Regardless of the results, both studies are flawed because large doses of vitamin E were used in conjunction with coenzyme Q10. In a 2003 hypercholesterolemia study, participants were given 200 milligrams a day of CoQ10, and their blood plasma levels were higher than people taking 1,200 milligrams a day in 2002. When scientists added 750 milligrams a day of vitamin E, CoQ10 plasma levels dropped significantly. In the 2002 and 2011 CoQ10 Parkinson's studies, vitamin E was added up to a maximum dose of 1,200 milligrams a day. Investigation of possible pharmacokinetic interactions between CoQ10 and vitamin E in humans appears warranted if vitamin E is to be included in future studies of CoQ10 in Parkinson's disease and other conditions. Ubiquinone is the oxidized form of coenzyme Q10. Ubquinol is the reduced form of coenzyme Q10 and is 3 to 5 times more potent than ubiquinone. In a randomized double-blind placebo-controlled trial of ubiquinol in Parkinson's disease, participants were divided into 2 groups: patients experiencing levodopa-induced wearing off and those with early Parkinson's disease, without levodopa treatment, with or without a dopamine agonist. Group A took 300 milligrams of ubiquinol or placebo per day for 48 weeks. Group B took ubiquinol for 96 weeks. In Group A, UPDRS scores declined. In the placebo group and Group B, UPDRS scores increased. This is the first report showing that ubiquinol may significantly improve Parkinson's disease wearing off, as judged by total UPDRS scores, and that ubiquinol is safe and well tolerated. Pyrroloquinoline, also known as PQQ, is the next generation of coenzyme Q10, and there is evidence that PQQ stimulates mitochondrial biogenesis. In Parkinson's disease studies, PQQ has been shown to prevent fibril formulation of alpha-synuclein, and it conferred neuroprotection in the rotenone model of Parkinson's disease.
I want to talk about a very serious health problem in America. And here's the problem. Millions of people have been prescribed a class of drugs called statins. These drugs are supposed to lower cholesterol and thereby prevent heart attacks. But here's some things that you have a right to know about these drugs. Well, first of all, do they lower cholesterol? And the answer is yeah, they lower cholesterol. But here's a very important question. Do they prevent heart attacks? No, they don't. Are they safe? No, they aren't. So if you're taking a statin, you're taking a drug to prevent heart attacks that does not prevent heart attacks. And further, you're taking a drug that is not safe and does you harm. Now, does that make sense? In fact, your statin drug could be placing you in mortal danger, setting you up for heart failure, as well as other conditions, including a deadly form of kidney disease. Given that statins are useless and dangerous, why do doctors prescribe them? Well, most doctors believe that high cholesterol is a main component of heart disease, and they view cholesterol-lowering drugs, the statins, as life-saving drugs. But this is fundamentally wrong. If cholesterol is so important, how do you explain the fact that half of all people who suffer heart attacks have perfectly normal cholesterol? Rather, what we actually observe is an increase in heart failure in people taking statins. So statins cause heart disease. One doctor fighting to unmask the dangers of statins is Texas cardiologist Dr. Peter Langstrom. He wrote in a petition filed with the FDA, here's a quote from this petition, filed with the FDA, "Statins kill people, lots of people, and they wound many, many more." And this is from a heart specialist. All patients taking statins become depleted in coenzyme Q10, especially those patients who already start with relatively low coenzyme Q10 levels, such as the elderly and people with heart failure.
United States Patent Number 4933165 was issued to Merck & Company Incorporated on June 12, 1990. A pharmaceutical composition and method of counteracting HMG-CoA inhibitor-associated myopathy is disclosed. The method comprises the adjunct administration of an effective amount of HMG-CoA reductase inhibitor and an effective amount of coenzyme Q10. HMG-CoA reductase inhibitors are statin drugs. HMG-CoA reductase inhibitor myopathy, muscle disease, is one of statin drug side effects. CoQ10 counteracts some of statin drug side effects. Parkinson's patients are also more likely to carry the gene APOE2, which is linked with lower LDL cholesterol. People with low levels of cholesterol are more likely to have Parkinson's disease than people with high LDL levels. Higher serum levels of total cholesterol were associated with a significantly decreased risk of Parkinson's disease. The association was restricted to women. Results of this large prospective study suggests that Parkinson's disease is not significantly related to history of hypertension, hypercholesterolemia, or diabetes, but may modestly decline with increasing blood cholesterol levels. This large prospective study suggests that high total cholesterol at baseline is associated with an increased risk of Parkinson's disease. A low intake of cholesterol, particularly in the presence of high iron, may be associated with an increased risk of Parkinson's disease. The secondary analysis of the DataTop trial provides preliminary evidence that higher total serum cholesterol concentrations may be associated with a modest slower clinical progression of Parkinson's disease. What makes these results especially useful is the fact that most of the men in this study were not taking cholesterol-lowering drugs such as statins. The data show that higher serum total cholesterol concentration is associated with lower iron content in substantia nigra and globus pallidus in Parkinson's disease patients. In a Chinese study that enrolled 555 Parkinson's disease patients and 555 matched controls, the fasting serum lipid concentrations of all subjects, including total cholesterol, low-density lipoprotein, high-density lipoprotein, and triglycerides, were measured. Parkinson's disease patients are with lower levels of total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides than controls. Lipids may be a marker of Parkinson's severity. In a study of incident Parkinson's cases diagnosed between 1998 and 2008, plasma lipids and statin use were examined in relation to Parkinson's disease in the Atherosclerosis Risk in Communities study. Statin use before 1998 was associated with significantly higher Parkinson's risk after 1998, after adjusting for total cholesterol and other confounders. Conversely, higher total cholesterol was associated with lower risk of Parkinson's disease after adjustment for total cholesterol and confounders. These data are inconsistent with the hypothesis that statins are protective against Parkinson's disease. Previous findings on the association of statins, plasma lipids, and Parkinson's disease are confounded by the fact that statins also affect lipid profiles. Men with erectile dysfunction on statin therapy are twice as likely to have low testosterone. Some researchers also have looked at the possibility that the statin's inhibition of cholesterol synthesis may interfere with the production of testosterone, which depends on a supply of cholesterol. Researchers at Rush University Medical Center found castrated mice had persistent Parkinson's-like pathology and symptoms. The research suggests nitric oxide, a gas naturally produced in the body that communicates between cells. When nitric oxide is produced within the brain in excess by a protein called inducible nitric oxide synthase, neurons start dying. After castration, levels of inducible nitric oxide synthase and nitric oxide go up in the brain dramatically. The authors of Prospects of Statins in Parkinson's Disease suggest there is a better option than statins. So let's look at some alternatives. Regular exercise, 30 minutes 3 to 5 times a week, lowers LDL levels and raises HDL levels. Regular exercise lowers body weight, which lowers LDL levels. Parkinsonian animal models demonstrate exercise-related protection of dopaminergic neurons from the release of brain-derived neurotropic factor. Serum levels of brain-derived neurotropic factor correlate with motor impairment in Parkinson's disease. Parkinson's disease risk in humans is significantly reduced by midlife exercise, documented in large prospective studies. A study from the Journal of the American College of Cardiology suggests statins can cut the benefits of exercise. A group of overweight men and women exercised for 45 minutes, 5 times a week over a 12-week period. Half of the group began taking simvastatin. At the end of the 12 weeks, the exercise-only group improved their aerobic fitness by 10% on average. The exercise and statin group barely gained 1%. All participants had muscle biopsies, and researchers found notable differences in the levels of an enzyme related to the health of mitochondria. In volunteers taking simvastatin, mitochondrial health fell by 4.5%. The same levels increased by 13% in the group not taking the drug. 19 men ages 24 to 62 were placed on a Mediterranean-style diet, which is high in fruits, vegetables, and whole grains, and low in red meat. It also includes olive oil and moderate wine drinking. Regardless of whether patients lost weight, following the Mediterranean-style diet resulted in a 9% decrease in levels of low-density lipoprotein, known as bad cholesterol. In a study population of over 131,000 men and women, 506 cases of Parkinson's developed over a 16-year period. Dietary factors were assessed in relationship to the disease. The prudent dietary pattern, characterized by high intakes of fruit, vegetables, and fish, was inversely associated with Parkinson's risk, but the Western pattern was not. In a trial on participants in the Baltimore Longitudinal Study of Aging, they discovered high plasma concentrations of vitamin C are associated with low levels of plasma cholesterol. Vitamin C deficiency has been shown to cause hypercholesterolemia. As little as 215 milligrams a day for women and 345 milligrams a day of vitamin C for men raises HDL levels to maximum levels. Curcumin is a component of the spice turmeric. The administration of low-dose curcumin showed a trend of reduction in total cholesterol level and LDL cholesterol level in acute coronary syndrome patients. In this one study alone, the authors feature 6 studies showing the neuroprotective effect of curcumin in the MPTP and 6-OHDA animal models of Parkinson's disease. Piperine is the alkaloid responsible for the pungency of black pepper and is an MAOB inhibitor. When combined with curcumin, piperine increases curcumin's bioavailability by 2,000%. Piperine potentiates the hypercholesterolemic effect of curcumin in rats fed on a high-fat diet. In the rat model of Parkinson's disease, piperine reduced cell death of nigrostriatal neurons by reducing inflammation and by increasing glutathione levels in the striatum. In a Chinese study, resveratrol exerted a neuroprotective effect on rats, protecting them from 6-OHDA neurotoxin-induced Parkinsonism. We found that the degree of exposure to resveratrol was enhanced by 229%, and the maximum serum concentration was increased to 1,544% with the addition of piperine. Consumption of a grape extract supplement containing resveratrol decreases oxidized LDL in patients undergoing primary prevention of cardiovascular disease. Resveratrol-enriched grape extract reduced atherogenic markers and might exert additional cardioprotection beyond the gold standard medication. In patients from primary cardiovascular disease prevention,